Okay, good morning, everyone. Good afternoon to some of you and good evening to some of you. I know we've got people joining us from far and wide. I want to thank you for taking the time to drop into the Center for Crisis and Risk Communications, our Communicating in a Healthcare Pandemic module. My name is Jeff Angel. I'm a principal at the Center for Crisis and Risk Communication. I'm here with Ben Morgan, who's my partner at the center, and on behalf of us, as I said, would like to welcome you to our webinar. Couple of housekeeping duties. I'd just like to make sure that everyone has turned on mute. So if you're not on mute, if you could turn on mute. And also we've got a number of people joining us. So if you could turn off your video feed, that'll help with the Zoom platform. So we get higher up in numbers. Sometimes it becomes less functional. If you have a question throughout the presentation of the module, you can hit the Q&A button at the bottom of your screen. If you move it on Zoom, you'll see it should be almost right in the middle. Click in your Q&A. We'll do the best that we can to answer all the questions. We'll try and read them off verbally rather than trying to furiously type back. If they're easy ones, we'll send back a yes or no. If not, we'll ask them and deal with them between Ben and myself. I think that's everything. So I want to start with. I was reading a story. I was telling Ben before the webinar. Was reading a story about a prisoner of war in Vietnam. Survived 7 years. I was trying to find his name before the webinar. I couldn't, so I apologize for that. But he was asked how he got through. What were the people that didn't make it? And he said, well, it was actually the optimists that didn't make it. Those are the ones that thought, okay, well, this will be done by Easter, this will be done by Christmas, and then that time came and they were disappointed. We are in the long haul here of a crisis, an unprecedented pandemic, and I just wanted to check that in. It's been tough for me. Ben and I have had some good conversations about, you know, how difficult it's been. We all have people that are feeling it, some more than others. Just wanted to check that in. The people that got through that Vietnam POW camp that this soldier was in, they were the ones that knew that they would get through it. They didn't have a date. They didn't have a particular time, but they knew that they were going to get through it. So I just want to start this by saying we're in this together and we're going to get through it. And that's critically important for me that all of you believe that. Just talk a little bit about myself, introduce myself. I'm 10 years in the airline industry. I headed up corporate communications for British Airways. Canadian Airlines first, then British Airways for North and South America. I handled the crash of Concorde and the response of that and the subsequent relaunch. Came back to Canada and I've worked in both Toronto and Calgary, consulting in the crisis communications space. Hooked up with Ben Morgan about a year ago, and Ben has got some breadth of crisis communications experience. He's part of the team at the City of Calgary that responded to the floods here in the city in 2013. Part of that crisis communication response. Then was set up to Fort McMurray, helped out the team up there, did some work up there. Former paramedic. Ben has a unique perspective on this, and together we came together to form the Center for Crisis and Risk Communication. We're passionate about crisis communications because in high stress, high concern situations, including a crisis, the rules of communication change. And if you don't change your communications, you're going to lose your audience. They're going to be unable to process the information that you're trying to give them, and that could have significant consequences. Ben's going to do a deeper dive into that in just a couple of seconds. That's our main message to you. In a crisis or high stress, high concern situation, the rules of the game change. I want to begin with a quote from Michael Levitt. Michael Levitt was the former governor of Utah, and he was Health and Human Services Secretary under George W. Bush, Bush 43. Everything we do before a pandemic will seem alarmist. Everything we do after will seem inadequate. And that's the dilemma. It should not stop us from doing what we can to prepare. We need to reach out to everyone with words that inform but not inflame. We need to encourage everyone to prepare but not panic. We're starting to see divisions within society right now, how we've handled it, how we've not handled it, who knew what, who should have done more. We're here today to talk to you about how to communicate through that and the best practices of communicating in a high stress, high concern environment. So with that, I'm going to talk a little bit about the Center for Crisis and Risk Communications. We're based here in Calgary, but we have a number of people across the country, in the US, but we're headquartered here in Calgary. As I said, we've been around for about a year. Ben and I met on a course about a year and a half ago. Both had a passion for communications, both had a passion for crisis, and out of that came the Center for Crisis and Risk Communications. So as Ben walks you through that, I want you to remember one thing. If you have any questions, either during the webinar, after the webinar, please reach out to us and ask. We're here to help. We care about people first. Our passion is helping people get through, both prepare, get through, and come out of the other end of a crisis. It's important that we all do that. That's critically important, not just to our society, but our communities and ourselves. So I'm going to turn it over to Ben now to add anything to add. And again, I want to thank you for joining us. This webinar will be available to be watched later. If you have any friends or colleagues that you think could benefit from it, please invite them in. We're here to help, and we'll have this posted for you. I'll let you know, all of you, afterwards. All right, Mr. Morgan, you want to take it away?
I sure do. Thanks, Jeff. First off, I just want to say, wow, thank you to everybody who has dropped in today. I'm looking at the list of names, and I see some amazing and inspirational communicators, some friends, some students. So it's humbling to me that you've joined us today. Our intent today, we really talked about this a lot. There are so many, everything is webinar now. And what we really wanted to do was just offer, if there was interest, for us to share a little bit of our thoughts, our insights, and a little bit, maybe some tools that might resonate with you. As Jeff said, I have a paramedic background, and I often think of crisis communications like taking a CPR course. If, when you take CPR, they teach you, you compress the chest 1.5 to 2 inches, 80 to 100 times, call 911, all that stuff. If you never use CPR for 10 years, but 10 years later, somebody you care about drops in front of you, if the only thing you remember is to compress on the chest, then you're doing much better good than if you hadn't have taken that course to begin with. So I hope when we talk about crisis and risk communications, my hope is that in this, there's one piece, one tool, one thought that resonates with you that perhaps you can take with you and use in your practice in the upcoming months and years. I much prefer doing this in person. I don't know if this webinar thing is going to become the new normal or not, but I much prefer seeing you. So what we're going to talk about today is high stress, high concern situations. And I think you would all agree that today people are feeling highly stressed and highly concerned in many different ways at different times. High stress, high concern situation, as Jeff said, changes the rules of communications. And it doesn't matter whether we're talking pandemic, COVID, or whether you got home and your significant other found an email that they didn't appreciate and they challenged you on it. That can cause high stress, high concern, and the rules of communication apply to that too. So although we're framing this through communicating through a health crisis, because that's where all of our most of our attention is focused right now, high stress, high concern situations can be applied in a variety of ways. The thing that makes this COVID-19 and pandemic quite unique is that it is always changing. I've actually started to tune out because I just find every time I turn on the news or turn on the social channels, there is something new. The color has changed. there's stripes on it. Now it's blue, and then you turn around and it's red, and it's hard to keep up. And as a communicator, whether you're communicating on behalf of your company or government, it changes so fast. And so it can become a real challenge to keep up with all of the information. And I'm going to talk a little bit about that. But in a nutshell, when we're communicating about pandemic, or we're communicating really about anything high stress, high concern, all I want is for you to be clear, confident, concise, and consistent. Those to me are the most important elements of your communications, especially in times like we're experiencing today. And I've added a bullet down at the bottom, simply for pandemic communications, refer to the trusted sources of information. I'll also touch on that in a little bit. Risk communications, especially, can be really quite challenging. We were working with one of our clients supporting their COVID-19 communications, and the direction from the CEO was, we need to share and communicate this. And my reply was, yes, that's very important, but if we share that information, what questions is that going to inspire from your audience? I think it's going to inspire these questions. And so, do we have these answers yet? So we want to communicate confidently, clearly, and concisely and consistently, but we want to make sure that we're not creating more uncertainty in our communications. I'll give you an example about that. These were some messages that came out earlier on, about a month ago now, as COVID started to ramp up. And the messages were: wash your hands, keep your distance from others, stay at home if you're sick, cover your mouth when you cough, make sure you have enough medications for you and your children for 2 weeks, and talk to your employer if you need to take time off work. Now, on the last slide, I said make sure you refer to trusted sources of information. Now, if we were all in a room, I would ask you, does this sound like authentic and trusted information? And when I did this presentation in person, the reply was, well, yeah, it sounds like authentic, real information. And it was. This was the message from Dr. Theresa Tam, Chief Public Health Officer of Canada, earlier on in COVID-19. And those were great messages. However, for me, I take those messages and I say, okay, you're telling me to wash my hands, but for how long? Is there a proper way to wash? You're telling me to keep my distance from others. Well, how far away? From everyone? Do I need to keep distance from family or just from coworkers? Stay at home if I'm sick, just with flu-like symptoms, or how sick do I have to be? Cover your mouth when you cough. Well, provide, the vampire cough into your sleeve. What does cover your mouth when you cough mean? Have enough medications for you and your children? Boy, that sounds serious. Do I need food, water, and toilet paper too? Talk to your employer if you need to take time off work. Well, you just told me above to stay home if I was sick. Do I need employers' permission, or is this the government of Canada? Is this direction sufficient? And so, although the messaging was great and coming out early, you now see, keep your distance from others. A month in, now the messaging is stay a hockey stick length apart, stay 6 feet apart, stay 2 meters apart, and they're starting to use visuals on how people can process what that means. And so we just have to be mindful that when we're communicating risk communications, that we're not creating more questions than we have answers, or to be prepared to answer the questions that you can anticipate coming. And one of the fun things about crisis and risk communications is that most of the answers, or most of the questions, can be predicted in advance. Crisis and risk communications. So when I teach crisis and risk communications, I'll ask, what's the point? Why are we doing or engaging in crisis and risk communications? Well, simply, if done effectively, crisis and risk communications can provide people a sense of hope, self and community efficacy, safety, calm, and connectedness. That's why we're engaging. You can also talk about crisis communication, protecting brand and reputation. We can also talk about increasing the reputation. We can talk about life safety and all that stuff. But generally, as we refer to crisis and risk communications, it really helps provide people a sense of hope. And I really love the community efficacy bit. On my street here, just last week, I got a little note dropped in my mailbox. It was from one of my neighbors. Hey, we don't know anybody on this street, and we should make a connection with everybody. And so now we have a group, text group that's happening. That it's great now because I'll get a text message. Hey, we're going to the grocery store. We should limit how many people are going. What do you need us to pick up? So the community creation and the community efficacy is really, really great. Earlier on, we also thought. You might recall there's actually now some criticism coming out of the government from people about the messaging that we were receiving earlier on. Telling people not to worry doesn't help. When the President of the United States says you are probably not going to die, that was his message earlier on, that doesn't help either. And that's actually, if you look at what's happening in New York right now, it's quite opposite of that. Telling people that there's a pretty low chance of contracting the virus does not help. Jeff made me take the video out, but I have this video. If you'll remember the movie Dumb and Dumber with, what's his name? The comedian. You know who I'm talking about. Dumb and Dumber. Okay.
Jim Carrey.
Jim Carrey, thank you. I just watched the Jim Carrey show the other day. Okay, Jim Carrey. So Jim Carrey, Dumb and Dumber, and he is after I forget her name too, the pretty woman, and he gets to her and he says, "Give it to me straight. Is there any chance that a girl like you could be with a guy like me?" And she says, "It's a pretty low chance of that happening." And he's like, "Help me understand that. Is that a 1 in 100 chance?" And she replies, "Yeah, it's more like 1 in a million chance that I would ever be with you." And Jim Carrey turns and he's like, "So you're telling me there's a chance?" Yeah. And so sometimes just saying there's a pretty low chance, that doesn't help because you're saying there is a chance. And so we need to be very, very mindful about our communications, that we're not adding to the sense of fear, and that we're not creating more questions for which we don't have the answers. There is science and research behind crisis and risk communications. There's a lot of theory out there. There's a lot of different scholars who look at different crisis and risk communication theories. There is science behind it. I had the great opportunity to work with and meet Dr. Vincent Cavello. If you don't know Dr. Cavello, he is one of the leading world experts of crisis and risk communications. He's based out of New York. The World Health Organization is his primary client. He's the guy that helps the World Health Organization with messaging during the Ebola outbreak in Africa or the wisteria in the Congo. But the neat thing about Dr. Cavello is that he actually has a master's degree in neuroscience. His PhD work is in communications. But he's the guy that puts probes on people's brains and tests messages, tests words, tests sequences, and he can watch which parts of the brains are being activated based on messaging and testing. We're very fortunate that he's our senior advisor to our company and helps us with some of our consulting work. And so what we're going to share today is all based on. So this is the credit, is all based on the science and research of Dr. Cavello. The tools that I'll share with you are also developed by Dr. Cavello, who, as our advisor, has given us permission to use these tools. And these are some of the tools that we use in any one of our crisis communications plans that we're creating or supporting organizations through. So that's, unless it's stated otherwise, what I'm quoting to you is the work of Dr. Cavello. So what he tells me and what resonates for me is that, yes, risk communication is a science-based discipline. He's proven it in the lab. He actually works in a lab in Geneva, Switzerland. In high concern situations, the rules of communications change. That's something as simple as the average human brain can process, under normal circumstances, approximately 7 pieces of information. 7 pieces of information is what the average human brain can process at one time. In high stress, high concern situations, that number changes to about 3. The average human brain can process about 3 pieces of information. If you think about that, before we had to worry about area codes because of our population, phone numbers were typically generated with 7 digits. There was a reason for that. That was the average number that people could remember, 7. When you're in a high stress, high concern situation and you need to call for the police or the ambulance or the fire, you are going to call a number that is made up of 3 numbers, 911. Why 3? Because under high stress, high concern situations, the average human brain can process 3 bits of information. So that's basically just a way to demonstrate the science and the proof behind how the brain processes. The number 3 is going to become very important in some upcoming slides. Also, the key to risk and crisis communications, the key to success is anticipation, preparation, and practice. I can break that down and say anticipation is something as simple as doing a business impact assessment, doing a risk assessment. So what is your organization at risk for? What are your key areas of risk? Understanding what my key areas of risk are, I can then start to prepare. And I'm going to do preparation by doing a risk communications plan, a crisis communication plan, and hopefully those plans are following an emergency response plan or a business continuity plan, following the operations of your organization. And the third is practice. So it's one thing to have a plan, and you've probably all heard the story about the plan binder that sits on the shelf for 3 years that never gets taken off. The key is anticipation, preparation, and practice. Risk communication core principles. When people are concerned or upset, and I would suggest that in one way or another, to one degree or another, people are concerned or upset today. When they are concerned or upset, they will have difficulty understanding and remembering information. And they will focus most on what they heard first. Think about the last disagreement or the last emotionally charged disagreement you had with your significant other. I don't really remember what that was about, right? The next day, wake up, what were we fighting about? I don't remember. I don't remember the information. I just know that this was the feeling I was having. And people will focus most on what they hear first, which leads me into one of our biggest philosophies here at the center, and this follows the work of Dr. Cavello, is that when people are concerned or upset, they want to know that they care before they care what you know. And that's going to become important in the next couple of slides here. Although Dr. Cavello has proven that with his science, he wasn't the first to say that. Theodore Roosevelt was one of the first people to say, nobody cares how much you know until they know how much you care. If you were in Calgary or you saw news coverage from the Calgary floods in 2013, you would have seen likely first up in the morning from a media briefing perspective was the mayor, Mayor Nahid Nenshi. He would give his briefing, and his briefing was very much community oriented. It was a message of care, compassion, and empathy. He would say, I was up all night, I was visiting community members, I saw how this has impacted you, and I want you to know that we're here for you. Following that would be the Director of Emergency Management that would provide all of the details and the information, the current status of re-energizing the energy grid, etc. It is really important that people know that you care about them before they care what you know. I look at WestJet recently, who had to release about half of their employees. I have friends that work at WestJet, and from what I understand from them, although they don't like it, everybody wants to go to work, the decision and the message about the changes to their employment was done in a very caring and empathetic way, which made it easier to hear. And that was a great example of caring message. People want to know that you care before they care what you know. And that's in a relationship, that's an employee to an organization, however it fits best into your organization. I want to share some crisis and risk communication tools. You can reach out to us afterwards and I can explain these in more depth. Again, these are coming from the work of Dr. Cavello, and they're what I use as my standard to go to. So 2793 is for use when responding to any high stress or emotionally charged question. And 2793 breaks down to 27 words, 9 seconds, 3 messages. So essentially, I've got 9 seconds to deliver 3 key messages for a total of about 27 words. Why 3 messages? This is where I ask you as the audience, and then you all say, because in high stress, high concern situations, the average human brain can process 3 bits of information. So we're looking at 3 messages. 9 seconds, when this research was being developed, 9 seconds was the average media soundbite that you might expect to get in a news cover story. And 27 words, because at 28 words, people start to tone you, the speaker, out. Again, that's Cavello's research. I asked him, why 27? He says, because at 28, people start to tune you out. So 2793, and I'll show you how that comes together in a short bit. If you have the opportunity to deliver 3 key messages, of those 3 messages, when asked a question with high emotion, and by the way, I also think of crisis as an event that is typically underpinned with emotion. Consider this, CCO. And CCO stands for caring, conviction, and optimism. So of those 3 messages that I've created, those 3 key messages, one of them, probably the first one, caring, should be a message of caring. Why is that first message one of caring? Because people want to know that I care before they care what I know. Second message is going to be one of conviction. We're going to get through this. Optimism, we're going to be stronger as a result of this event. So caring, compassion, or caring, conviction, and optimism, CCO. And that can be supported into the 2793. However, there's another template that I see happening more so with this COVID-19, and that's the KDG. So this is used to give upset people a greater sense of control and response. I've added the response. Cavello says sense of control. I've added the response. So KDG is know, do, and go. So from COVID-19 as an example, here's what you need to know, here's what we want you to do, and here's where you should go for more information. We need you to know this is what's happening with the virus. We need you to wash your hands and stay away and keep your distance from people, stay home if you're sick. And here's where you can go for the latest information. KDG, know, go, know, do, go. The other one that is also appropriate for COVID or pandemic is the KDD. And KDD is simply, oh, I forgot to add the other ones. Know, do, and do. This is what we want you to know. This is what you need to do. And here's what we're asking you to do. So it gives them that sense of control and response. Know, do, and do. And those all, again, fit into the 2793 formula, if you would call it a formula or a tool. The other one that I really love, when breaking bad news or having to state a negative, is the 1N equals 3P. And that's used to balance one bad news or negative message with at least 3 or more positive, constructive, or solution-oriented messages. So we need approximately 3 positive messages to balance out 1 negative. This can actually be very helpful. I used to call it the sentiment bank, the corporate sentiment bank. The 3P, the 3 positives, can be done well ahead of an event. this is the great work we're doing. This is how we're committed to community. This is some good news about WestJet. Again, is a very great example of the 1N equals 3P. They are always putting out positive messages. You'll see in the Christmas miracle bits that they do. They come across, I might suggest actually that when WestJet first started, they didn't call their employees employees. They called their employees owners. We're owners too. You're owners. You're in this with us. And that starts to create a very positive sentiment, so that when they do have to deliver some bad news, they've already got that kind of positive culture in many ways. So the 1N equals 3P is another really helpful tool. The message map is a fantastic tool to help create and organize your messaging and your thoughts. I get asked all the time, is this all we use? And I said, no, a message map can support your briefing notes. Your message map can support your speech, your town hall, or whatever you're doing. Your message map is just a way to help support your messaging and your thoughts. So based on 2793, I've got 3 key messages. Of those 3 key messages, I am likely going to start with one that is caring, one that has conviction, and then one that has optimism, or it might be the KDD or the KDG. So it might fit into one of those. It's, however, one thing just to deliver a key message. Your key message needs to be supported by facts or have support points. So I'll give you an example, and I'll go back to the Calgary floods. I might say key message number 1 as an example might be the safety of the public is our top priority. We care about you. Safety of the public is our top priority. It's one thing just for me to say, this is our priority. I have to demonstrate and show how I am adding truth to that. So public safety is so important to us. Folks, we've got 120 police officers from the city of Edmonton that have come down to help keep our community safe. Support point 2, we have 88 firefighters from the city of Vancouver that have come here to help support our efforts. In fact, we take public safety so seriously, folks. We have the Canadian military here in Calgary helping to protect our critical infrastructure. So you need to support those, each point by support facts. Otherwise, those key messages can become what might feel empty. I just started to play with this a little bit, and then of course we got busy. But an example might be from an organizational perspective, the wellness of our employees is a top priority. And I'm going to support that by saying we've made changes to our sick time policies, right? We've posted effective hand washing instructions in the bathrooms. However it is, it's as an organization, I need to be able to demonstrate how and why the wellness of my employees is a priority. Well, I'm missing the slide. So that's the message map. Again, feel free. I get very passionate about this stuff, and I could talk about each one of these for quite a bit. Happy to talk about those further if you want to reach out. Not Cavello, but I started to use this during the Calgary floods. And again, this is just a way that I found useful in helping me organize information, and then I would create messaging out of this. And I would also look at each one of these boxes to inspire me to look deeper. So as an example, if I haven't got anything populated in the what we don't know box, maybe I need to go figure that out. Maybe I need to go find that answer, what we don't know. If I don't have anything in the rumor busting box, maybe I need to dig a little deeper and see if there's a rumor floating out there. You've heard with COVID-19 about all of the misinformation that's floating around out there. So this 4 box is just for me to organize information. What we know, what we don't know, what we're doing about it, and then is there an opportunity to bust a rumor or correct misinformation? And then I would take that and then create my messaging out of that 4-box method. We were getting lots of questions about when do we communicate, when should we start communicating. This is probably a little old now, but it still holds really relevant, I think, when we're talking general crisis communications. If you look back, you know, the old way of communicating, when we had a crisis event, we would try to get all the information, we would put together a news release, we would get it all approved, we would issue that news release about 4 hours into the event. We no longer have that luxury. The conversations about events are happening very, very quickly. You know, the Boston Marathon bombing as an example, the first image to pop up on Twitter was posted about 42 seconds after the first bomb exploded. That's when the conversation started. And it took Boston authorities about 4 hours to be a part of that conversation. And you all know that in the absence of information, that's when the misinformation starts to fill the vacuum or the void. So the time to communicate is now. It's always now. It's never, with some exceptions. There's always exceptions to the rules, right? So the time to communicate now. I put this slide up because it's a very jumbled mess, and I feel like that's very representative of what's happening in the world today. You know, if you were new to this interchange and you were trying to get to a destination, I think I would find it very confusing. But this to me symbolizes an expression that I use, and it's stay in your laneway. Stay in your laneway with your communications. And what I mean by that is, what is yours to communicate? What is yours to share? When I was the public education officer for the City of Calgary Paramedic Service, we actually had to have an agreement, a written and signed agreement between the paramedic service, the fire service, and the police service. And it said, you'll talk about this, I'll talk about that, but I won't talk about this. And we tried to stay in our laneway. And it was challenging at times because some of the events or some of the calls we were talking about often overlapped. So stay in your laneway. And that to me is, as an organization, you should be communicating the changes that your organization is making in response to COVID, not trying to become the authority on COVID. And there's so much information right now. I see it all the time. It's like, what's the goal or the intent of sharing that? Because me personally, I'm only looking to the trusted source of information in Alberta. For me, that's Alberta Health Services, the government of Alberta, and then I also watch the World Health Organization. Stay in your laneway. But as a organization, you need to be communicating the changes that are affecting your organization because of this. I had something else to say about that. I always ask the question, do I want to own this? If I don't own it, so if my organization doesn't own an event, my pipeline broke, my well exploded, my food was bad, if I don't own it, I am very careful to put ownership on anything else. So an example, when I was the lead of the public relations department for the City of Calgary, Environment Canada would issue a air quality advisory because of the smoke from the BC forest fires. And we were expected to message about the air in the City of Calgary, but we didn't own it. So I was very careful with the messaging to say, not there's an air quality advisory, because that as soon as I say that, it starts to create more questions from citizens. But I would always say Environment Canada has issued an air quality advisory, and here's a link to their website for more information. Now I had to respond to all of the operational bits that was happening in the city because of the air. You know, we were moving golf course workers had to come inside, day camps were being canceled. That was mine to own, but the smoke in the air wasn't mine, and I would never touch it, but I would share and point to that trusted source of information. Use your established communication channels. We're in the middle of stuff. Don't start trying to make up channels unless you don't have any. but where does your audience, where do your stakeholders typically go to find information? So if you're a, if you're an organization, do they look to your intranet site? Do they look to your emails? Unless those are failing, you may not want to start creating new channels and trying to get people to go to a new channel unless it's necessary. And collaborate, make sure you're collaborating. If you're in communications, you have to make sure you're collaborating with appropriate business partners. So is that HR, is that law? Who do you need to talk to make sure that your information is being clear and comprehensive? Share information from trusted sources. This can get kind of tricky for some organizations. We're working with an organization who has operations here in Alberta, but also has operations down in the United States. So if I simply am looking to Alberta Health Services or the province of Alberta as the trusted source of information, that may not resonate or be helpful for my employees that are actually working in the States. So you have to take into consideration where your staff are and what messages you're sharing with them. I would share information that is relevant and then inject it with organizational specific messaging. And why are we doing all of this anyways? Because people will deal with tragedy far better than uncertainty, and pandemics are uncertainty. And we need to help as organization and as communicators help people through these uncertain times. And we do that primarily by letting our people know, our stakeholders, our customers, our employees, our shareholders, our stakeholders, that we care about them, and that they need to know what operational changes are being made to help them along. So with that, I'm going to pass it back to Jeff. Please do post any questions, or if I'm out to lunch or you want to challenge me, I love a challenge. Learning comes from good conversation. So I'm open to hearing anything, but I'll toss it back to Jeff.
Thanks, Ben. I want to talk a little bit about crisis leadership. As Ben said, we've got a question. You can fire it in the Q&A there. We've already got I've got a couple, Ben, that we can tackle at the end. So I'm going to push on and talk about crisis leadership and our own character and our own values. There's another saying that says, hard times don't build character, they reveal it. I want to give a couple of examples of organizations where they probably could have thought things through a little bit more. So nobody gets any hometown discounts here. I'm gonna call out the Calgary Flames. This is a couple of weeks ago when COVID-19 first broke. They immediately laid off all of their part-time staff. Put some context around this. There was about a month left in the National Hockey League season, and the part-time staff are typically students and people that are cobbling together a couple of jobs. They're not at the top of the socioeconomic demographic in society. These are real people, and they're trying to make it work. They immediately laid them off, and I was one of the people that called them out on it, in particular because they had just received $300 million in government funding from the city of Calgary to build the new arena. So me and a whole bunch of other people called them out on social media, and we said, look, to use Ben's term, you need to pick a lane. If you're going to take government money, that's one thing. But you can't act like you're just report to your owners and your shareholders. So they eventually made the right decision and paid their part-timers until the end of the regular season. I want to put this in context. The Edmonton Oilers, who were in the exact same situation out of the gate, they said they're going to bridge their part-timers so that they can get employment insurance benefits. So two organizations, two very different takes on things. So the Calgary Flames weren't alone, but they were in the minority. The Winnipeg Jets also did this. They did it not only once, it was on a Thursday, they doubled down on a Saturday. They said there was no way they were going to pay their part-time workers. and they eventually changed their mind a couple of days later. So my challenge to all of you is to think about what your values are, both for yourself personally, for your own organization. And what are they, and what do you want to communicate through these difficult times? We don't demonstrate out of the gate that we care for people, as Ben said, the Teddy Roosevelt quote that Dr. Gavello has done the research on. If we don't demonstrate that we care about people, nobody is going to listen to us. Nobody. They're not going to care what we have to say. And out of this crisis in particular, I believe people are going to have long memories. So my own personal values are kindness, reliability, and engagement. That means when I show up, that I'm engaged, that I bring my A game, that I'm ready to engage in whatever activity I'm taking on, and that I demonstrate empathy, that I try and put myself in the shoes of my audience as often as I can, and understand that there's really only one person's day that I know exactly how it is unfolded, and that is mine. I don't know how anyone else's is gone. I don't. I don't know if someone's having a fight or having financial difficulty or on the verge of a relationship ending. I don't. So it's critically important for me to demonstrate as much empathy as I can. And so before I'm done, I'm gonna call out one more organization. Let me start with demonstrating, giving you an example of an organization that I believe has done it well, and they were pretty quick out of the gate to do it well. I've received an email from every company organization that I've touched in the last 10 years telling me they're here for me. I don't know what that means. Maybe it means they want to hold my hand, but I know we can't hold hands now. I don't know what that means, and it's become very old and tired quickly and a little bit frustrating. I want to give a shout out to Ford, because Ford was one of the first people. They ran a commercial. It was just a blue screen with text on it, and they said, if you are having trouble making your payment on a Ford, finance or lease, contact Ford Credit right away. Now that is something to communicate. So one of the rules we follow at the Center for Crisis and Risk Communications is don't just communicate for the sake of communicating. Have something to say. And as Ben walked through the message map, we demonstrate empathy first, and then we go to our key points, 3 of them, to support our overarching message. So shout out to Ford. Here's my call out to Ticketmaster. Ticketmaster in this crisis, even though concerts have been canceled or postponed, is not offering anyone a refund. All right, if anybody from Ticketmaster is listening, that's not the right thing to do. Even people that have bought concert insurance, in case the concert was canceled, they're not getting a refund because Ticketmaster is saying it doesn't cover pandemics. So you could have bought your ticket, had the concert postponed, and have insurance on your ticket. You're not getting a cent back from Ticketmaster. If there's another way to buy a ticket in the future going forward, I'm going to do it, because those aren't the values that I expect of an organization in today's world. Ticketmaster, I'm talking to you. If anybody's watching this or anybody knows anybody at Ticketmaster, tell them they need to bring some common sense back to their organization. Okay. I'm going to ask you to define quickly. You don't have to share this with anyone. Just jot down, what are your personal values as a leader? Everybody on this webinar is a leader. You wouldn't be joining in if you weren't. Take the time. What do you, maybe kindness is one of mine. Maybe it's professionalism. Maybe it's respect for others. Whatever they are, jot them down quickly. And also what your values are for your business or organization that you're in. What do you think they are? What do you think they should be? And finally, in your values as a community and a community leader, what are they? take that, just quickly jot them down. It shouldn't take long. And if you're struggling with them, that's okay. Then ask yourself, maybe I want to think about this a little more. Maybe you want to do a little bit of a deeper dive into what your own values are, because our values dictate how we show up in life. And that's critically important now more than ever. How we show up in this crisis, how we help, and you're seeing lots of examples of people helping others. So I'm going to give a shout out to, there's a couple of breweries that started in Calgary and then some in the States that moved from producing beer and alcohol to producing hand sanitizer. That's a demonstration of their values, greatly needed. In the province of Alberta, we're blessed from a decade of good planning with Alberta Health Services. We have extra supplies of PPE, personal protective equipment, that we're now sending to the rest of the country, other provinces. That's a demonstration of values, both here in Alberta, and I'm going to give a shout out to AHS, Alberta Health Services, for that. And I also want to give a shout out to Dr. Dina Hinshaw, Dr. Bonnie Henry in BC, and across the country. Generally, our public health officials have done a very good job of communicating to us in a empathetic, effective, and clear way. So I want to thank them for that. So now that we've looked at our values, I'm going to ask that you take them forward. I'm going to ask that when you feel that they're being pushed or compromised, that you stand up for them and make the point of doing that. And explain, look, this goes against who I am, or this isn't who I line up with on my values. These are some of the ones that in the work that we've done with our organizations and businesses, these are some of the values that have come up that people both personally and within their organizations have put down. So feel free to take from this whatever you think or believe lines up with your own values and the values of your organization. And I'm going to ask that you push your organization and your community and us, frankly, to live up to these values as often as we can. Because when we don't, there's a disconnect. There's not only a disconnect within us internally, there's a disconnect within our organization or within society. You're starting to see some of that now. The fault lines are starting to push hard against one another and rupture in society. There'll be lots of time to look back and say, what could we have done better? What could we have improved upon? And that is crisis postmortem 101. We always look to see what we could have done better, how we could have communicated better. So these are the slides of the breweries I was talking about, a couple in Calgary and then a couple down, and one was in Georgia, one was in South Carolina. So a shout out to our friends down south. I know it's some tough days that you've been going through. So our hearts go out to you. To remember the caring, the compassion, the optimism, and the integrity. We are going to get through this crisis. How we get through it is entirely up to us, but we will get through it. We remember these 4 components. So we're going to finish up, and then we'll go to the Q&A. I've got a couple, Ben, that will support, that we'll send you. So the Center for Crisis and Risk Communications can support you by creating your pandemic messaging or your crisis messaging, helping you write your plan. We've audited the plans of a number of organizations, big and small, help them, some of them write their crisis communications plan, some of them rewrite it. We've done a number of rehearses, tabletop exercises. We're a big fan of experiential learning here at the Center for Crisis and Risk Communication. We want to put you through as much of the real thing as we can so that when the real thing hits, you're ready for it. We can support you 24/7. We used to say in person. Most things are done now virtually. That in-person plan, that in-person communication will come back eventually. Again, we don't know when, and I'm not gonna predict a date. I don't know when the date will be, but I do know that we will get through it and we'll be here. And we provide training and coaching for that. So reach out to us. Our website is crisiscoms, CRISISCOMMS.ca. You can fire us a link there. Reach out to us. Every Thursday, we have a Crisis and Coffee. So that's 3 o'clock Eastern, 1 o'clock Mountain, noon Pacific. Drop in. We have an informal chat. There's lots of back and forth. We've got lots of folks, lots of emergency management professionals and crisis communicators drop in and have a chat. So you're welcome to do that. That's every Thursday, which is tomorrow, 3 o'clock Eastern, 1 o'clock Mountain, noon Pacific. Okay. That's it. I know we're mindful of time. If you have to go, we understand. We've got a bunch of questions. Want to start off that we had one off the top. Ben, I'm going to throw this to you. Is it too late if we haven't prepared for a crisis either at all or well enough? Is it too late? What do we do? Do we just throw in the towel, or what can we do?
No, it's never too late. I feel anyway, never too late. In fact, I want to share, we're supporting a client right now who has no communication staff, who has no communications plans. They support an at-risk community. They had really no established communication channels, and they are currently doing amazing work. We quickly put together just a communication strategy, if you want to call it a strategy, and kind of when we were working through that, we helped them establish a couple new communication channels, some theories. We gave them these tools, 2793, CCO, those foundational bits. What's exciting to me about that is when this is done, we can take that comms strategy or comms plan, we can take COVID-19 out of it, and they have a good foundation to start building a crisis comms plan, because it identifies who they need to talk to, the channels they have available, some new ones. They've got some messaging templates. They've got some key messages. And so although they've just responded really quickly to this event, coming out of it, they're now going to have a foundation that they can leverage and work on moving forward so that they're prepared for next time.
Great. And I know you touched on this question in the chat, but it's important enough that I'd like to bring it up again. Ben, what's the risk in becoming your own resource for communicating health tips and what to do in a pandemic? Why don't we want to set ourselves up to be the resource around what are the proper things to do?
Yeah, so we're not the authority, and the challenge can be, I'm looking, Joshua, you were asking specifically about, if we can find it here, tips on science or technical communications, like changing recommendations on mask use, etc. And things like this change, and they change rapidly. The first slide, the beaten over the head from Monsters Inc., it changes so fast. And I'll just give an example. So one of our clients wanted to share, the Alberta Health Services has a screening tool in place, and they're asking people, if you have these symptoms, go to the screening tool. And the messaging was considered to go deeper into go to the screening tool and if, if you have this, then do that. And the challenge is that night, Alberta Health Services changed the screening tool and changed the information and the direction behind it. So as soon as we start getting out of our laneway, that we run the risk of that information becoming irrelevant and inaccurate. And then we're doing our stakeholders a misservice, right? Josh, you're asking about the mask use flip-flopping, right? And how do you message that? So for me, unless I'm the health authority, I'm not messaging on mask use. But for me, it's something as simple as how do you frame it? And when they said masks won't help, simply framing that somehow, our current research suggests that masks use won't help. That gives you the opportunity to come back and say, we've done, because this is so important to us, because we care about this, because we're so responsive to this, we've done more and more testing and more research, and we now believe that. And then you can, when you come out with words that are absolute, no, mask use won't help, that has kind of set you, a fence line that you can't cross. And when you do cross it, you look like you don't know what you're talking about. But if I simply frame it in a way, current research indicates that this, but then that leaves me open to come back and say, and I'll set it up as a caring message, because we care about this so much, because this is so important. We hear from the community how important this issue is to you. We've done more research, and we've now found that. So you can help demonstrate your ongoing commitment by not being so, my wife passed away from cancer and years ago, and we were told 4 times that we were at the end. And I'm like, why do you be so absolute? Just tell us, don't give us 2 weeks, because it's a year later now, and so you've just kept losing that credibility. But if you speak from your heart and you say that, based on our knowledge and our research and what we're seeing here, we think that, without being so absolute. Yeah.
And Ben, I remember that conversation we had that night working with the client, because Alberta Health Services, and this is an organization that by all standards has done a pretty good job, but they changed their assessment tool to go from, if you have these symptoms, call 911, to if you have these symptoms, call 811 and self-isolate. They did that in real time as we were talking. So to your point, the information can change quickly, and we don't ever want to be seen as the authorities on health. We want to refer to the trusted authorities, because that can change in real time, as you said.
Yeah, absolutely.
Okay.
Diana, did that answer your question? I don't know if you saw that, but Diana was asking about the role of authenticity in crisis comms. And it seems like there's a direct correlation between authentic messaging and trust in organizations. If you notice my Twitter handle, it's Daydow, and Daydow Morgan, and Daydow loosely translates to authentic. We can no longer, as an organization, as an authority, afford not to be anything but authentic. We are so connected, and information flows so fast. If me as a organization leader is not being authentic, I'll be called out on it. And so yes, there is a direct relation to authentic messaging and trust. I'll call out Dr. Dina Hinshaw. I'm a huge fan because I didn't understand. We hosted a workshop in Edmonton last year with Dr. Cavello. He was here. We did a workshop, and in that workshop was a woman named Dr. Dina Hinshaw, and I was flabbergasted why there was a physician in our risk and crisis communications workshop, and it was, very similar tone about authenticity and caring and empathy. And, not that we would ever take credit for the amazing job she's doing, but simply to have that foundational, or to, I just thought it was amazing that she was there on her own, because she actually really cared. And that's what resonates today in the messaging that she's delivering.
Right. Good point. Although we probably are a little biased, right, Ben? Because she did take our course and she was lovely, and so it's nice to be able to know, have a real connection with the people that are up front delivering the pandemic messages. I also want to do a shout out. You talked about authenticity, and I use this as a crisis communications leadership example, not a political one. I don't care how anyone votes on this webinar. I do care that you do vote. I don't care how. But one of the people that's done a terrific job has been Premier Ford out of Ontario, who is really connected. You talked about that authentic way. He's gotten very high marks for connecting with people. And I don't think anybody, even his most ardent supporters, would have expected him to come across this well. But has certainly done a good job of just coming across as genuine, authentic, demonstrating empathy, all the things that we talk about that are critical in crisis communications. Done a really, really good job. So I want to give a shout out to Premier Ford too.
And then Dallas, I see you're still here. So 2793, specifically the 27. I'm equally guilty for going on. I actually do the sidetrack ramble. The 2793 is a tool that you can use. So I'm not sure if you have a comms background, but if you're creating the 2793, it's something you can put in front of that leader to say, here's your anchor points, if you will. The 2793 is a great way when you're being asked tough questions from the media, or maybe tough questions from employees during a town hall, to have that there, that just allows them to be clear and concise and succinct. And without that there, and that might just be an addition to their speaking notes, right? But having it there is one thing, but training and coaching them ahead of the time. We get uncomfortable. We do this in our media training. We get very uncomfortable with the awkward silence. We don't want that silence. And so if the reporter just stops, we kind of feel like we need to fill in that void, and we keep rambling. So the more tools you can give your leaders, the more training that you can provide them so that they're comfortable with the tools and they understand why they're there, would be very helpful.
So Ben, we just have a question here from Alex, who asks about any tips for communicating internally within a large multinational organization. Why don't I take a stab at this, Ben, and then you can feel free to build on it or add it. Alex, so I would say there's a couple of things, and I'm going to use as examples. Number one is establishing, as Ben talked about, regular communication. So whether it's once a week or twice a week, maybe even daily, it's important to have that regular communication. And I'm gonna call out the Prime Minister a little bit on this, because I believe his daily briefings are running a bit tired. They were certainly needed initially at the beginning, but we want to be mindful in a large organization, or I would even argue government, that the leader does not become the chief spokesperson for that organization. You need some other person or entity to be the chief spokesperson, and then the leader runs the organization. So I would say that's a critically important point. Ben and I did on the Inspired podcast with Bart Egnell from the Humphrey Group a couple of days ago, and we had this good discussion. So he said, so the less is more, kind of like the Queen, who's communicated 4 times since World War II. This is one of them. And I said, yes, but somewhere in between. So we want to be mindful of the leader being the chief spokesperson. We want to avoid that, but we do want to communicate regularly and clearly. And that's also a good tip for on Ben's thing, was rumor busting. When I worked at both British Airways and Canadian Airlines, we would tackle the rumors head on, because they would spread like wildfire. So having that regular, consistent, and whatever that is, if that's an email, if that's maybe internally you use Yammer or something else, however you communicate, you would typically communicate before. Use that tool and have it regular, consistent. Make sure you say something. There's probably lots to say right now, and make it worthwhile in saying, and save the CEO or the leader of your organization for the really important ones that you need that extra added attention. Ben, you got anything to add there?
Yeah, I would say, Alex, who the heck was your prof? Huh. I was. That's why he's left with so. That's why he's left with so many questions.
Right. So those still on. Ben also teaches at Royal Roads University. So.
And Mount Royal. Yeah, and Alex, a sharp kid. If anybody's looking for a go-getter, Alex is the guy for you. International. So I would say if you're talking large multinational, make sure that the content you're creating is relevant to the different to your different sectors, right? You can't just crank out one organization from head office corporate and think it's going to resonate across the board. So how do you make sure that you're speaking in the right language with the right tone, respecting the culture? It may be very different. So you may need different spokespeople. I'll give you an example. One of the clients we're working with right now, they're a First Nations community, and they have some Stony speaking people that speak Stony only, some that don't speak English, some that speak both, some that speak different dialects. There's 3 different nations. And so although we're not talking multinational, we're talking same community, but 3 nations with different dialects. And you need to make sure that you're speaking to each one of those sectors or segments in a way that resonates and speaks to them. So it's, yeah, so I would say that. So make sure you're recognizing the unique needs of every one of your different sectors within that organization, if that answers your question.
Okay, I think we have covered them all, Professor Morgan.
Well, thank you, sir. I just want to say thanks again to everybody who popped in. We're passionate about this stuff, trying to figure out how we can make a difference, how we can support. We try not to add to the clutter that's going on out there, but we're here and we care about our folks in our community, and reach out if you think you might need any extra support.
Yeah, so please do that. I want to echo Ben's comments there. Thank you very much for joining us. Stay safe, wash your hands, reach out to the Center for Crisis and Risk Communication. This is not about budget or how much money you have. This is about doing the right thing for the community. So reach out. We would be pleased and honored to help you. Thanks again, everybody, for joining us. Coffee and Crisis tomorrow at 3 o'clock Eastern, 1 o'clock Mountain. Hope to see you there. Go to our LinkedIn or our website for the invite on that, and we will talk to you soon.